Chapter 23. The Heart and Circulation 2. A. Physical examination. Medical examination is normally carried out in 4 stages. Inspection, looking, palpation, feeling with the hands, percussion, tapping with a finger, and auscultation, listening with a stethoscope. Note: the verb is palpate. The noun is palpation, not palpitation. See Unit 22. B. Examining the heart and circulation. Here is a extract from textbook description of how to examine the cardiovascular system. Look at the lips, tongue, and nails for the blue discoloration of cyanosis. Cyanosis may be central or peripheral. Inspect the hands for clubbing. Feel the radial pulse at the wrist and note the rate, for example, 70 min. And read regular or irregular. The pulse may be irregular on force as well as time. Check that the other peripheral pulse is present. Measure the blood pressure and assess the jugular venous pressure (GVP). Palpate the chest for the apex beat. The normal position is the 5th left intercostal space of centimeter medial to the mid-clavicular line. Feel for any theories. Heart size may be measured by percussion. Listen for murmurs and other abnormal sounds, for example, friction rhythms, beginning at the mitral area. Murmurs may be soft or loud. A harsh murmur is loud and raw. Now the time of any murmur in relation to the cardiac cycle. The most common murmurs are mid-systolic, in the middle of systole, pan-systolic, listening for the whole of systole, early diastolic, mid-diastolic, late diastolic, pre-systolic. Continue by listening at the tricuspid, aortic, and pulmonary areas. Finger clubbing, areas of auscultation. The letters indicate the approximate position of the heart valves. P. Pulmonary valve, A. Aortic valve, M. Mitral valve, and T. Tricuspid valve. The circles indicate the position for auscultation for cardiac murmurs, indicating valvular heart disease. The ribs are numbered. 23.1. Complete the table with words from A opposite. Put a stress mark in front of the stressed syllable in each word. Verbs and nouns. Auscultate, auscultation. Examine, examination. Inspect, inspectation. Palpate, palpation. Percuss, percussion. 23.1. Put the steps of examining the heart and circulation in order according to the 4-stage system. A. Measure the heart size. 5. B. Are there any murmurs? 6. C. Feel the radial pulse. 2. D. Look for clubbing. 1. E. Locate the apex beat. 3. F. Note any thrills. 4. 23.3. A doctor is presenting the case of a 43 years old woman at a meeting in the cardiology department. Complete the text of her presentation. On examination, she has pyrexia with a temperature of 38.5. She was short of breath. Her pulse was variable between 100 and 180 and was irregular in time and volume. Her blood pressure was 130/180 and her JVP was up 5 centimeters, showing normal movement with respiration. Her peripheral pulse were all present and there was no central or peripheral cyanosis. Her apex beat was displaced to the anterior axillary line but still in the 5 intercostal space. Her heart sounds were very interesting. When she was initially examined, it was noted that she had pan-systolic and mid-diastolic murmurs, heard best as the apex. When she was examined some hours later, there was a harsh pericardial friction rub all over the pericardium. Our diagnosis at that time was of mitral stenosis and incompetence with a recent onset of pericarditis and atrial fibrillation.